Barnstable this morning, just about 10 minutes toward the top of the hour. I'm Sarah Colvin, and joining me live on the phone, I welcome 5th Barnstable State Representative Randy Hunt. Randy, good morning.
Well, good morning, Sarah. How are you doing today?
I'm doing well, thank you. And yourself?
Well, we're down in Texas on a pre-Thanksgiving holiday trip, so I'm going to escape some of the colder weather for the next few days.
Definitely a little warmer, I would imagine, in Texas than it is on Cape Cod today. Well, I thank you for joining us from the long distance, and I believe there's a little time change from us to you as well, correct?
Well, we're an hour earlier here in Dallas. By the end of the day, though, I'll be in El Paso, where I was born and raised, and that's in the mountain zone, so I'll be a couple of hours behind.
Indeed. Well, again, thank you so much for joining us, Randy, and congratulations on your win earlier this month. Nice to continue to have you here as a guest on the show.
Thank you.
So wanted to talk, of course, about one of the topics that you've really been working hard on, and that is the substance abuse and addiction issues, and wanted to talk a little bit about, what are the updates and what are we looking forward to continuing to work on in the next couple of years?
Well, a couple of things are coming together now, and I put out an email to the people that are on my distribution list for the Mental Health and Substance Abuse Joint Committee. And you can, by the way, you can sign up for that email list. Just shoot me a request going to randyhuntstaterep.com. And in that email, I included a copy of the editorial page from the Cape Cod Times from Sunday, which had 3 opinion pieces all about this issue, reminding everybody that the opiate addiction issue has not gone away. I know we haven't had all of the number of articles about heroin overdoses on the front pages lately, but that's not because the problem has attenuated at all. And so I sent out this email with a copy of that editorial page, with permission, of course, from the Cape Cod Times, and then also pointed out that we have put together this commission now that was as a result of what I've called the Assist Act for the last year or so. That passed, and so the commission meets on December 5th for the first time to look at nonviolent offenders in our criminal system and just what we ought to be doing to get these nonviolent offenders who have substance addictions on the road to long-term recovery. It's basically the question between incarceration versus treatment. That commission comes together on December 5th, and we'll have a report available to the state by the end of 2015. Another thing that I think is really important is Cape Cod Healthcare, on its own accord, has put together some docs and other people in the administration of Cape Cod Healthcare to put a protocol together relative to prescribing opiate medications and trying to deal with the issue of overprescribing or even in some cases unnecessary prescribing of opiates for patients. And this protocol, they're putting the finishing touches on this. I hope that that protocol is going to become something that will be used across the state and further out in this country, because they're really hitting one of the issues head on, and that is legal drugs, pharmaceuticals that are prescribed, but sometimes in such quantities that they get diverted and used for illicit purposes.
Indeed, and really that is such a huge part of the puzzle, the prescription aspect of it, and so many stories of folks who were injured or had surgeries and were prescribed opiates and then found themselves addicted, and it can go so many different ways, and I think that is one, at least something that can be relatively easily addressed, and will take a burden off some of the population, at least. Again, big part of it, but not the whole picture.
That's correct, but you have to deal with all of the pieces of this puzzle, and I think that's an extremely important one right there. So some of the things that we've been working on are coming together. I think that's the message that we have. I would like to say that the issue of opiate addiction is declining, but according to everything that we know, it is not. But we have to keep working on issues or solutions from policy standpoint to the things like what Cape Cod Healthcare is doing with their protocol, to just getting more treatment available to people who need it so we can get them into long-term recovery, which is far, far cheaper than dealing with the aftermath of some of these people who are addicted.
Absolutely, absolutely. And we, of course, we will have a new governor in January, and understand that he has committed to dealing with this issue as best he can.
That's right. Governor-elect Baker has said that he will be putting out a very substantial initiative relative to opiate addiction during the first 6 months of his governorship. And I hope that that will just continue to give us the boost that we need. We're moving in the right direction, and this issue is clearly not lost on Charlie Baker, and I'm glad to hear that from him.
Indeed. And we talked a little bit about Cape Cod Healthcare's protocol, but I wanted to talk a little bit about prescription monitoring as well, and where we are on that particular initiative and how that will help.
The prescription monitoring program has been around for quite a long time. However, prior to about 3 years ago, only 4 to 5% of the prescribing physicians of these opiate drugs were in the database. So we made some changes in the law a couple of years ago to accelerate that, and then during the health emergency that was called by the governor back in March of this year, we accelerated that even more. And now every prescriber of an opiate drug is in the database, and so it won't take too long before that database becomes much more robust, and we're able to use that in an effective way to discourage doctor shopping and to identify anybody who might be over-prescribing these drugs. So it's good that we have everybody in the system. The bad news is it's a little bit clunky, and I hear from a lot of several doctors and their staff that they're having a difficult time trying to learn how to use the database effectively and efficiently. And I think that we ought to be able to, as part of our longer-term program, come up with a revamped database that's easier to use, and I suggest that it would be cross-state so that all 6 New England states would be able to participate in it.
Makes a lot of sense. Well, Randy, I thank you so much for joining us to talk about this important issue. Enjoy your holiday in Texas. Enjoy that warm weather, and we will talk with you again in a few weeks.
Thank you, Sarah.
Thanks so much.
Bye-bye.
Bye-bye. 5th Barnstable State Representative Randy Hunt joining us.